Okay. See who else is joining. Have only three of us. Couple of minutes more. Checking message. Let's see who sent me a message that they can attend the class for any reason. No, nobody has sent me a message. So, okay. Okay, then let's continue with the class. Remember, yesterday we were covering the reproductive system, males and females reproductive system. So, no message. Oh, the males and females reproductive and those word parts, how to break down a medical term and how to define each iris part. Remember, that is actually the intention with this course to learn the medical terms in every different system because well patient has lots of conditions and we need to know exactly what part of the body is it that the patient is talking about or what part of the body has the condition or needs to do a procedure or needs to go to a specialty to be evaluated. So let's go down to this part when we left off. Okay, we left off right here in this area. We talk about DNC. Remember, these are dilation and curettage. It's also called DNC. So basically, that's how we kind of because it's very kind of difficult to say all these things, dilation and curettage, because some of the times the words by itself are difficult to be pronounced, because remember, it's not English. So we use acronyms, DNC. Whenever you see the word DNC, the patient is getting some dilation and curettage. So that's basically what it is. We talk about endometriosis. Remember, endometrium is the inner layer of the uterus. So whenever we have an abnormal condition of the inner layer of the uterus, but usually is that this abnormal condition happens when we find endometrium outside of the uterus. So we find it within the fallopian tubes mostly. So instead of pregnancy developing within the uterus, which is the right side, if you will, to develop pregnancy, it develops within the tubes. So there is no space for a pregnancy to be developed in the tubes. So the fallopian tubes, therefore, the patient presents with some symptoms, probably vaginal bleeding, some abdominal pain or pelvic pain, uh, a lot of stuff. So this is an emergent situation because an ectopic pregnancy has occurred. Remember, ectopic means that something is out of place. Ectopic pregnancy means that a pregnancy have happened outside of the uterus, which is where it's supposed to be. So that's basically what it is. We talk about fibroids. These are kind of masses or a kind of pieces of the muscle of the internal organ. The growth, this is growth inside the organs. Later on, we're going to see some images right here to show you the fibroids. It's not cancer, but we need to evaluate them just in case. Because once again, it is a tumor, but there are two types of tumor, malignant and benign. Malignant tumors are those who contain cancerous cells. So this is very bad. That's what is called malignant. Mal means bad. Benign means good. Comes from the Latin word good, bueno, benign. So benign doesn't have cancer. We talk about the pap smear. Remember, this is a vaginal examination. So the patient is not going to say, oh, listen, I'm here for my pap smear or for my Papa Nicolau. Usually they say, I'm here because I have a GYN exam or a vaginal examination. Or they just say that the doctor is going to do some exam. So we need to be prepared for this. PID, remember, this is PID. We have it later on as an acronym, pelvic inflammatory disease. This is when the entire or part of the female's reproductive system is infected by a bacteria or a virus, usually sexually transmitted disease, and kind of damage the lining of the uterus, the fallopian tubes, the vagina, the I said it all. So it will be the uterus, the fallopian tubes, all those things will be kind of damaged because it produces swelling and implantation of the placenta is not possible due to the fact that the walls are swollen and the placenta doesn't stick right there on the walls of the inner layer, which is the endometrium. Therefore, the female tends to have a miscarriage. Most of the miscarriages are due to pelvic inflammatory disease, as well as ectopic pregnancies. This sexually transmitted disease, these have changed. Now we call it sexually transmitted infection. So disease is no longer used because disease is something that can become chronic, something that like diabetes, like arthritis. Sexually transmitted infections, on the other hand, means an infection is something that can be treated easily with antibiotics or other type of medications, depends on what is it, the infection that the patient develops, antiviral infections, antifungal infections, antiparasitic infections, all depends on what is it that the patient is being what microorganism the patient has developed, if you will. With other medical terms that are not divided. So these are not built from medical parts. So these are the structure, or these are the terms for the male reproductive system. Here, the first one that we have is benign prostatic hyperplasia. Now, pay attention that it says right here, benign. If you have a tumor that is benign, that means it's not cancer. So when the patients have benign prostatic hyperplasia, what it's telling you is that the patient has the prostate enlarged. It is enlarged. It becomes kind of larger and thicker. But it's benign. It's not cancer. I don't need to remove it. But it does cause certain problems with the urinary system, because the prostate it is surrounding the urethra in the males. And when it kind of enlarge, constricts the urethra that passes in the middle. So males have problem peeing, voiding. So that's the problem with males after 50 because benign prostatic hyperplasia or BPH, because that's how we know it better. Because remember, it is a lot easier to say BPH versus benign prostatic hyperplasia. So we usually don't say all, we don't spell it out, in other words. So we just say BPH. So whenever you hear about BPH, the patient comes in, it is someone who is over 40s or 50s, male, and they said that they have BPH, so it's the prostate that is enlarged. So that's basically what it is. No worries about that. They're just gonna give the patient medications to kind of, put the muscle of the prostate back to normal. That's basically what it is. So the patient can relax the urethra that is constricted in between this gland. Here is another term common, particularly in pediatrics department, circumcision. Circumcision is nothing else than the removal of prepuce, which over covers the head of the penis of the child or the male, if you will. So what is done is just to remove this foreskin from the head up of the penis. That's called circumcision, and it's done many times at birth because it's a lot easier to do it when the child was just a little baby and the penis is small and it's not sexually active. Then it's when it's going to cause issues. Once again, this is voluntarily. Most of the mothers or the parents goes for a circumcision, but it's not a mandatory procedure. The parents needs to agree with this. So that's circumcision. Next, we have digital rectal examination. So usually this is very common in males, but it can be done in females as well. Why? Because we are trying to detect, this is a test when the medical provider inserts a finger on the patient's rectum. Now, whether to evaluate the prostate through the rectum, because that's one of the easiest way to do it, or to check for internal bleeding. Of course, the medical provider has to have gloves on, right? Put a glove, introduce one of the fingers, use lubricant around the anal canal and put the lubricant over the glove, and then introduce a finger on the rectum of the patient. It's very common to check the prostate, and males have prostate. Females do not have a prostate. So it's very common sex exam for them. That's what it's called, DRE, digital rectal examination. Remember that it can be done also to check for colon cancer, internal bleeding. So if the patient is internally bleeding, what we do is put the finger inside the patient rectum and remove a little piece of stools, put it on these wire cards, and to evaluate whether it's occult blood or not. So again, that's part of urinalysis. That is part of these non-blood specimens that we collect in the office, which is stools. So that's digital rectal examination. Yes, the females can also get it if we suspect that you might have, some internal bleeding, and we check to see if cancer of the colon or the rectum it is has developed. And checking the stools, we're gonna find out so we can do a more specific test, like doing colonoscopy or getting a biopsy. Maybe if we see we encounter something inside, like polyps. Next, we're gonna have erectile dysfunction. This is known as ED. Erectile dysfunction is commonly known as impotence. This is for males. Remember, we're talking about here the male's reproductive system. I believe it's right here. Yeah. So prostate has to do with males. Circumcision has to do with males. The digital rectal examination, we do it mostly males because we're gonna check for the prostate or for colon cancer, which is common for both males and females, but this is mostly prostate enlargement that we look for. So erectile dysfunction, remember, this has to do with impotence, which is problems with the male's penis not being able to acquire an erection. That will be discussed in anatomy and physiology during the male's reproductive system, because it's a very, very common condition which patients comes to the doctor a certain age in their lives. So it is important to know it. Then we have something right here that it reads prostate specific antigen. This is very important for you as a medical assistant. Why? Because the medical doctor is going to order something that is called PSA. This is a blood test that is done to males to detect whether the patient might have of the prostate. So this is a blood test. Remember, the digital exam is just to see whether the form, the shape of the prostate and the softness of the prostate is there. If we notice like has nodules of the surface of the prostate is not soft enough, so we suspect that the patient might have some type of issue right there, so we need to do a biopsy. Before we do that, we send for a PSA. P, prostate, S, specific, A, antigen. So you better get very familiar with this test because the medical doctor is gonna order it. Most of the time, it is ordered in patient males older than 50 years old, because that's when the prostate changes start happening. So for that reason, we do it at that time. So it's the most common time. Well, if you find someone else younger than 50, maybe in their 40s, doing this type of test, well, this is probably this person have a family history of a member of the family having developing prostate cancer prior. So when we have a family history of having medical condition related to this particular structures of our body, we do the evaluations. Oh, let's rephrase it. We start the evaluations earlier. It's like for females. Females are supposed to get a mammograms after 40s or 50s. But if we suspect that you have a family member that develop, particularly those very close family members like mothers, sisters, grandmother has developed cancer of the breast, we're going to do mammographies sooner, earlier, because you are in that range of risk. So we have to start earlier to prevent something later on. So we just do the mammography earlier to make sure, and we're going to start evaluating you instead of every 4 years or every 2 years, depending on what the doctor decides, depends on the risk factors. So we're going to do it more often. That's basically what it is. So PSA, remember, is a test to evaluate through the blood. This is a blood specimen that we collect whether are these presence of cancer of the prostate. So we gotta get familiar a little bit with all these things because it's very important for you to know it. Just knowing that, okay, this is a test for the prostate. Well, it doesn't stick well. But if I said that this is a test that you're going to be doing very often, and this is a blood test, and this is a serum bottle test that you're going to use, usually you're going to get the gold tube or the red and gray. So these are the tubes that are for serum. So this is the tube that you're going to do. So that's basically what it is. So that should have been discussed in phlebotomy. If you have not had phlebotomy, well, we will discuss it. Good. Any questions about these particular tests or procedures that was done? Good. Let's talk about here these acronyms. Remember, an acronym is nothing else than a abbreviated term. It's not an abbreviation, but it's an abbreviated term when we use the first letter of each word, because there are too long words or because they are difficult to be pronounced. So we just say it like that. It's like CBC. It's like HIPAA. It's like OSHA. It's like the FDA. We use lots of acronyms. Why? Because it's a lot easier for us to say the FDA instead of the Food Drug Administration and Cosmetics. Yes? Oh, let's turn the microphones off, please. Okay. Okay, so let's start with the first acronym, BPH, benign prostatic hyperplasia. We have it before, it is written in the previous slide, so this is just for you to remember when you see it, because when you see these acronyms standing alone, it is hard to figure it out what it means. Some of you might know, oh yeah, HIPAA, OSHA. But when you try to spell out these terms, it's a little troublesome. So we need to know the acronyms, but we also need to know what each is for. This is like knowing a medical term. We need to know what parts makes this medical term. That's basically what it is. DRE, this is the digital rectal examination. Remember, D&C, dilation and curettage. ED, erectile dysfunction. PID, because when you have exams, that's what they're going to give you. PID, PSA, ST, well, here it's supposed to be STIs. We don't say STDs anymore. STDs is an old term. Remember that I mentioned whenever you see STI. This is correct. This is replacing STDs because now scientifically proven have changed this term now because now we know that STIs are infections. Remember, these are microorganisms that are transmitted through sexual encounters. But these are infections because they are viruses, they are bacteria, they are parasites, they are fungal infection, and these are microorganisms that causes infection. So for that reason, it was changed from STD to STI. So if you see STI, don't think that they make a mistake or they trying to to trick you. No, nowadays it is STI. It's for you to know. So PID, pelvic inflammatory disease. Remember, pelvic inflammatory disease is one of these conditions of the female's reproductive system that causes most of the ectopic pregnancies. So if you have in your exam, which of the following conditions causes an ectopic pregnancy? PID is one of the major. But if it's not PID and you have STIs, so STIs are to blame for many of the conditions, not exactly the ectopic pregnancy, but some of these sexually transmitted infections are the ones that causes the female reproductive swallow to inflame. So that's basically what it is. They swell and, well, think about it. So not good. So miscarriages, ectopic pregnancy, PID. PSA, remember, don't forget about this. Very important because this is a test, blood test, that is done with the purpose of identifying if there is any cancer cells within the prostate. STIs is sexually transmitted infections. So that's basically what it is. So we might have those infections, those sexually transmitted infections that are the most common, that I believe they are in this chapter. Not sure. I know that I saw it once. It's been a long time. Well, not a long time, but the last time that I taught this class, it was like, before the pandemic, I guess. So probably it's there because I remember all this. Okay. Oh, here they are. Sexually transmitted diseases. Once again, infections. We have here AIDS, which stands for acquired immunodeficiency syndrome. Now, let's talk about HIV, because this is the basics for the patient to reach to AIDS. So this virus, because these are viruses, the ones that causes HIV, is called a human immunodeficiency virus. So this is a virus that it is transmitted sexually, that it is transmitted through blood transfusion if that blood was not analyzed prior to transferring or doing the transfusion to this patient, or with a equipment that it was contaminated with somebody else's body fluids. Body fluids means anything from seminal fluid, vaginal fluid, blood, that it was contaminated or saliva or tissue that was contaminated with the virus. So people sometimes mix these terms up. So be careful with this, because just because you have HIV does not imply that you have AIDS. That is not true. But in order for you to develop AIDS, you must have HIV. Sounds confusing, right? So the fact that someone has the virus of HIV does not correlate, implies that the patient already have AIDS. No, it's not. In order for a patient to develop AIDS, you must have the virus first. But not everybody who has the virus develops AIDS. That's what I'm talking about. AIDS is a condition where the immune system of the patient has been compromised completely, meaning this virus, this HIV virus, destroy more than 90% of the defenses that we have in our body, all the white blood cells and the lymphatic cells is being destroyed. And I take years to do that, 10, 15, 20 years. Now, if you have other medical conditions, it's going to take less. But if it is being treated, HIV is being treated, then you're not going to develop AIDS. It's for the people who was not treated. So remember, these are very sensitive topics. Back in the days, people, if they have the condition or they didn't even know about the condition, because this condition is actually recently new. This is not 100 years. That was in the 60s that appeared. So the 60s are not far away. So that's basically what it is. Or wasn't treated, or was embarrassed to go and take the exam, or was afraid. So then you develop AIDS, because if it's not treated, HIV then leads to AIDS. But if it is treated, you're not going to develop it. So that's basically what it is. AIDS, let's assume that AIDS, let's compare, let's change the wording. Let's compare AIDS with cancer. Cancer, when at the beginning, when it starts, it can be treated. It can be eradicated, meaning eliminated for good. But if you don't treat cancer, it's going to spread around the body. That's called metastasis. And when that happens, there is nothing we can do for the patient. So the patient cancer is not treated. Now it invades the entire systems. It's killing the good cells. Now they take over the good cells. Now the body is unprotected. Now the patient is prone to die of anything, a flu, a little cut. Something that for someone who has the immune system good is not going to happen anything. For them, that will be devastated, failure. So that is more likely what's going on for those who probably didn't know much about these conditions. So this is a very easy way to explain it to you, so you don't mix them up. Now, someone who has the virus or has AIDS, of course, they can pass this to someone else. So we have to be very careful with all these sexually transmitted diseases. So with all these infections, remember, even though if it's not AIDS, we got to worry because COVID killed millions of people. So it's just an infection. Next, let's talk about syphilis. Syphilis is a bacterial infection. The bacteria that produces is called the Treponema pallidum. So mark this down, write it down, because this is a question for the national certification. They ask either or. Okay, what causes syphilis? Then you said a bacteria, look for a bacteria. If you don't find bacteria over there, look for Treponema pallidum. That's basically what it is. So this is the bacteria that causes syphilis. Syphilis is very serious if it's not treated. Also, it's very lethal. It kills the patient. It is contagious because someone who has syphilis, someone who has HIV, can pass this bacteria or the virus to the partners or to the person that they are in contact with. So that's basically what it is. So I had to be careful with, all these conditions. That's why we have to follow OSHA and our workplace, because we don't know what the patients have. Next, genital herpes. We specifically write down here this genital because then we know that this is a sexually transmitted disease. Herpes, and just like HIV, is a virus, which are these microorganisms that we cannot kill, unfortunately. If you develop a virus, you're going to keep that virus forever. It's not going anywhere. We give you medications to kind of put them to sleep. Killing them, we put them to sleep. But if your immune system becomes compromised, meaning that your immune system weakens due to other medical conditions, then these viruses comes alive again. They wake up and they attack you again. Those are viruses. So viruses, we do not kill viruses. There is no medication to kill a virus. None. There are medications for bacteria, fungal infection, that kills them. The only microorganism that we don't kill is viruses. That's why HIV is so difficult to treat. That's why COVID was difficult to treat. And it took so many people's life before we kind of stopped somehow the spread of the infection from, killing more people in that magnitude. Still doing it, still people dying from COVID. But the COVID now, it became like the flu. Do you know that flu kills people every single year? And we don't know it. Because this is something that now stick with us, just like COVID. COVID is going to stick with us as long as humans are living in this world. So it's not going away, because these are viruses. Viruses, remember, we don't kill viruses. There is no medications to kill viruses. There are medications to eliminate, to kill, to eradicate 100% bacteria, fungal infection, parasites, not for viruses. For viruses, we just numb them. This is like putting anesthesia on the viruses, so they do not multiply and don't take over our body. It's like putting all these dangerous people, let's put it that way without offending anyone, let's put it that way, putting all these dangerous people in jail so they don't harm anymore. They can harm themselves, but not anyone else. That is what we do with the viruses. We put them away, we enclose them, we encase them, we gel them, but they do not die. And they can come out at any time in our lives if our immune system becomes compromised or medications are stopped. So then, bad news. Good. So this will be genital herpes. Remember, there are different types of herpes. That herpes that you have sometimes sores in your mouth, most of the time, that's not genital herpes. Most of the time, things have changed because all of these, new or not new, all these techniques, sexual techniques, if you will, the people, well, use humans always trying to find something different. So for that reason, we got to make sure that we get evaluated. So that will be herpes. How do we, oh, that would be herpes now. Remember, syphilis can be treated. It's a bacterial infection, cured. Genital herpes, no. How do you know that you have genital herpes? Because you develop blisters, a little papules, a little bubbles in your genitals. And they contain this little liquid. Should not be broken. These little blisters should not be poked because that liquid that is inside is the one that contains these viruses, and they're going to be spreading around wherever they have contact with this liquid. So that's basically what it is. It's very obvious when someone has genital herpes, particularly if it is on the external genitalia, outside, like in the labia, in the females, the male, well, the penis, right? But it is difficult to detect if it is internally, particularly females, if they have it internally in the vagina or the uterus, then it will be different to catch. You don't even know, but there are some symptoms for that. So once again, very important to be evaluated. Usually we discover this when we do the pap smear on the females, because for males it's very obvious because the genitalia is external. So, and it's better to go to the doctor and they evaluate it because it might be something that looks like genital herpes, but it's not. So can be mixed up with something else. So it has to be evaluated by a medical doctor. Okay, venereal warts. Now the warts, venereal means they are transmitted through sexual intercourse also. The most common virus, because this is a virus, is HPV. You probably are familiar with this because it's been a lot of talk about this. The human papillomavirus, HPV, and you heard this controversy about vaccinating the girls before they have the first sexual encounter to prevent them from getting it. Believe it or not, the ones who carry this virus are males. So if the male has a sexual intercourse with the girl that is not being vaccinated for this, they are 95% chances of getting it if the male has this human papillomavirus. So that's basically what it is. So if you see some genital warts, that is the venereal warts, or these are the ones that contains the human papillomavirus. There is like over 100 human papillomaviruses, and they are distinguished by numbers. So the doctor has to run a test, analyze, get the fluid from the patient, and vaginal or urethral secretions, send it to the laboratory to microbiology department, and then they will detect if you have or not these infections. Remember, if it is biopsy to detect cancer, it's going to be sent to pathology. But if it is these sexually transmitted diseases, it's going to be sent to microbiology because we are looking for microorganisms. That's a very different thing. So once again, very common in females, but females develop the condition, males don't. Males contains the virus that it is passed to the females, but the males do not develop cancer of the cervix because they don't have a cervix. They pass it to the female during sexual intercourse, and then the females develop it. Needs to be vaccinated prior to having sexual encounter. It's their first one, and they know. So very important, all those things. So we have to be kind of educated to understand all these, not to just go over what people says in the media, because well, we get fascinated for many things as we, from the moment that we are born. So this is another vaccine that is being brought to protect the patients for that condition. So it's better to do it because remember, these viruses, once they enter the body, they don't leave. They're going to stay there forever. Well, if we prevent them from entering, then you're not going to have them. See, you're not going to have them. That's what vaccines do, because we have vaccines for viral infections. We don't have vaccines for bacterial infections. No. Why? What did you do that? We have medication that kills the bacteria, but we don't have medications to kill viruses. For that reason, we give you vaccines so we can prevent from you carrying them on the first place. So that's basically what it is. So that will be the venereal or genital warts. Next, gonorrhea. Probably heard about this. People use this as, some coarse words to offend someone or something like that. They call it gonorrhea. I heard that in my country. We use that a lot. So once again, this is a sexually transmitted infection, and it is a bacteria as well, same as syphilis. So if you ever have a question about gonorrhea, it will be what causes gonorrhea, just like syphilis. Oh, it is bacteria. If you don't find bacteria as an answer, you should find Neisseria gonorrhea. Well, you don't need to know the first part because you see right here that it says gonorrhea. So Neisseria gonorrhea is the name of the bacteria that causes gonorrhea. Differs from syphilis because syphilis, it says Treponema pallidum. So there's no relation. It's not syphilis pallidum or Treponema syphilis. So here we need to know. The other one, once again, the name is there. To understand, particularly when you are dealing with questions in your exam. These are very sensitive topics, should not be engaging in conversations with the patients about this because it's very sensitive and we can, it can go either way. So it can go really bad or who knows. So it's better not to engage in this situation. Patient complains about something you might suspect, or you see the doctor doing some type of testing in the genitals. Don't answer any questions to these patients. Don't give the input on anything that you might be knowledgeable about it, or you probably just wanted to make a comment, don't. These topics are very, very sensitive. So be careful. I recommend you to stay away from this. Next, chlamydia. Chlamydia is another sexually transmitted disease which is caused by a bacteria. Anytime that the patient comes with chlamydia or gonorrhea, mostly is gonorrhea because gonorrhea is like more the symptoms. You might have some discharge from the genitals, from the urethra, so you might notice something different. Chlamydia is very, very different, and it can be kind of unnoticed, if you will. So if I treat you for gonorrhea, I'm going to treat you for chlamydia. So I'm going to give you medication because these are bacteria, remember. And because they are bacteria, I'm going to treat you for a medication that works for gonorrhea and works for chlamydia. Or I give you two medications, one for gonorrhea, the other one for chlamydia. But I'm going to treat you for both, even though if I have only tests for one, I give you for the other one. Because they occur always in pairs. So this is like gonorrhea and chlamydia are married. They go everywhere together. So if the patient presents with one, we treat you for two, for both, so to speak. So that's basically what it is. So understand which ones are bacteria, understand which ones are viruses. Here we have one more. Of course, this is not the end. There are many other conditions, but these are the most prevalent in the office when the patient comes in. Trichomoniasis. Remember, this is a medical term because it's a condition. This is a parasitic infection. It is a parasite that causes this. Yes, you heard me. It's a parasite. And it's called Trichomonas vaginalis. So think about the name, vaginalis. So that means that occurs, it is more prevalent in females. So females get it, develop, and pass it to the males when they have sexual intercourse. That's what is happening. So again, very important to understand. So the most important thing right here is protect yourself. Protect yourself and use whatever method is possible, particularly males should be protecting themselves to avoid passing or spreading, because you can get it from someone and then you partner with someone else and with someone else and so on and so forth. That's how you transmit these infectious diseases. So this is a parasitic. One of the most common symptoms of this condition is like the smell. The smell is a fishy smell. This is a very, very foul odor. And this fishy odor because smell like rotten fish. So it's very noticeable for the person who has it. Fortunately, well, people sometimes don't take care of these conditions. Or they just clean themselves, put some lotion in there so it doesn't smell bad. But the truth is that this is getting worse and can affect other organs. Not to mention, you can pass it to someone else and it can become a condition that is spread around. Okay, so this will be the sexually transmitted diseases. Any questions? Good. Okay, so moving on. Here are some of those terms that we discussed before, but just for you to understand how this occurs. Here is endometriosis, endometriosis. Remember, osis is the suffix. Metri is the word root, which is the inner layer of a layer of the uterus, but this is the inner because this is the prefix endo, inside the inner layer. So this is a abnormal condition of the endometrium, so the inner layer of the uterus. So this inner layer of the uterus can grow outside of, see, here is the uterus, and it's supposed to be inside the uterus, but here is outside. Here is outside, see? Here is outside. This is not something common, it's outside. Whenever you see these little dark spots, that's where we have endometrial tissue. So this tissue is not supposed to be there. But somehow there is an abnormality in the patient's, development of these tissues that grows outside. And because the endometrium is the one where the placenta and all those things during pregnancy happens, this endometrium, because do not belong there, they cause bleeding. And the female can end up in the emergency because they might think that something is bleeding and it's not the menstrual period, or they can mix them up with the menstrual period because it presents symptoms kind of saying you're having vaginal bleeding. So now it says, oh, wait a minute, I'm having this vaginal bleeding. I have this crampy pain, this PMS. And then you said, oh, wait a minute, this is not the time that I'm supposed to have the period. Why am I bleeding now? Or you have a heavy bleeding during your menstrual period. So we have to evaluate to see exactly what's going on. So that is endometriosis, remember. Here we have fibroids. Remember, those fibroids are little masses. I usually don't like to call them tumors because tumor sounds really bad. And once again, the patients, when you tell them tumors, they freak out. So they said, oh my God, so I have cancer. So I avoid to use tumors as much as possible, except in the case when the patient actually had cancer. Other than that, I don't use it. It says right here, myoma, see? Oh, my bad. And oma. So remember, oma is a tumor. My is a muscle. This is a muscle tumor. So it's just muscle. As you see right here in this image, a little growth of the muscle of the uterus, which is called the myometrium. So muscle, like myocardium, but that's the heart. Here is the myometrium because it's the muscle of the heart. So right here, these myomas or fibroids grow. Sometimes they are very little, sometimes there are many, sometimes. So think about it. If you have those fibroids, and you have them all over your uterus, not good. Why? Because if you become pregnant, then the placenta is not going to be able to attach because it has all these nodules right there. So the placenta cannot adhere to the walls of the endometrium. So therefore, you lose your baby, miscarriage. So for that reason, they are important. They cause bleeding when you have many of them, or they cause obstruction for something because they are grow very large, so they don't give space right here within the inside of the uterus, or if it is in the ovaries, can grow anywhere. So these are called fibroids. So either it has to be that has to be removed, even though if it's not cancer, if it's causing some problems, they have to be removed. They have to be shrink, meaning make it very, very small, or to cut, to remove them. And if they don't cause you any problems, leave them alone. That's how it is. These are the fibroids. If they cause problems, then we'll give you treatment. If they don't, you just leave it alone. Okay, moving on. Any questions?
How come there's no need to remove them?
Because they are not cancer.
But see, that's the thing. Like, for example, the reason why I lost one of my ovaries was because I had a cyst in my right ovary, and then they told me the same thing, but then that got
No,
worse.
no, pay attention. Well, no, I'm not telling you the same thing because these are totally different.
Okay.
An ovarian cyst and a fibroid, two different things.
Okay.
An
But it
ovarian
just seems
cyst is a
like
sac that contains some pus in the guy, that
okay,
contains
like
some blood.
what I'm
Mhm.
saying is that it seemed like the doctors they didn't mind, like they didn't care at all. I was 8 years. 8 years went by of me suffering with that, and literally nobody cared. They just said, "Oh, it's gonna go away. It's gonna dissolve, like something like that," but it never did. It just
Yeah,
got,
that
big.
is that is true if they got the right diagnosis. Fibroids sometimes they just the same way that they appear, they disappear. The fibroids,
Okay.
cysts, they don't disappear. They become larger. And remember, these ovaries are very small. And because they are very small, not only causing troubles, destroying the ovary, but you're not going to be able to generate new eggs. So you're going to become sterile. So for that reason, one, I'm not defending any doctor because I don't know the whole story and anything else, but I'm telling you based on what I know. Um, usually, not usually, most of the time, evaluating the ovaries is so hard because it's a very small structure, internal structure. This is not like the uterus that I have a machine that I can put through and I can look and I can check the vaginal fluids. I can do many things because there is a space. That's why we do these screening tests. Screening tests are like, the pap smear. There is no screening test for the ovaries. So some of the conditions goes unnoticed. And if the patient complains about some vaginal bleeding, we focus on other things besides the ovaries because we think that something bigger is going on. So when we actually realize is at the end, oh, things were out of control. So yes and no. So the main thing is just evaluate every single structure of, the body that we might kind of think that has something. It's just that it's difficult same for tests and things like that because sometimes we don't have a special test for this. Not to mention, now that you is it is that insurances don't pay for certain exams, for certain tests. So even though if I evaluate you, I come out with a diagnosis, the insurance do not allow you to get this particular test that I want you to do. So that is the problem. So not only, that it's difficult to diagnose, but also that, we don't have all these tools, all these means to assist our patients with all this. So that's my take on this. But every case is different, you know what I mean? But I just telling you based on the knowledge that I have, the cysts are totally different from the fibroids. The fibroids are benign. They just cause trouble because if they become large or too many of them, they're gonna kind of obstruct certain function of that particular structure, which make you bleed. But cysts are a different issue. Okay?
Okay.
All right. So whether it was you, whether it was someone else, listen, fibroids are very common in females. So this is a topic that people has to discuss about. Some people don't say anything and don't take, the first step to protect themselves for anything. That happens like with sexually transmitted diseases. These fibroids are not caused by sexually transmitted diseases. The cysts are not caused by sexually transmitted diseases in many cases. So we have to talk about them and, explain to the doctor what might be happening to you so they can kind of address these issues. Okay, thank you for asking and commenting about this because these are serious issues. Okay, let's move on. Circumcision. So as you can see here, this is a patient, the image, let's put A, and this is image number B. Image A, this is the prepuce of the foreskin of the patient. And if the foreskin of the patient usually ends and is very narrow, that can cause lots of problems later on for the male. So what they do is they remove the foreskin. See, this is a process 10 minutes and it's done on a newborn or in a very early age because we don't have many kind of blood cells in that foreskin. We're not going to bleed too much. It's not going to be too painful versus if you do it at an older age, that would be a little compromising. I have these patients that I have to order a circumcision for many reasons. At age 17, 18, 20, up to 20 something I have. So it's really problem for them. But then they have to deal with it because otherwise the problem is going to continue. They have to make a decision. So this is a circumcision for just the removing of the prepuce. That's what is called this over layer of skin that is covering the head of the penis. When it is very narrow, they cannot retract. So when it's going to retract, it causes pain, it causes bleeding. So who wants that? So it is recommended that is do it. Now, certain cultures, they don't care whether it's very narrow, the foreskin or not. They just do it. So other cultures don't allow it. So once again, the parents decide because it's minor, someone who cannot make decisions for themselves. They can make decisions after they reach the age of 18, and then, well, it's not too late, but it is really troublesome at that time. So that would be circumcision. Okay, so let's see how much we gather, how much we retain for this chapter. So, pretext. Let's talk about this. Without menstrual flow. Remember, flow is because of the blood that comes out, or period. Without the menstrual flow, the menstrual period means the same. A, B, or C. Remember, very important for you to understand this. Let me know on your chat. B or C. What happened? I don't see anybody responding. Anybody? I don't see any responses. Anybody's responding? Okay, one. Maybe you're checking your notes, that's fine. Remember, without. The key is without. That's it. Okay, I'm gonna give you another minute. Okay, so let's solve it. So we have here without menstrual flow. So without is at the beginning because we're gonna look for the prefix. The prefix. So let me see, somebody else had an answer right here. No, I told that there were some answers. Okay, so let's start with the prefixes because that is what is going to give us the clue. This. This means painful, abnormal. So difficult. Menorrhagia. Oh, it says that the patient is having menstrual period. That's not what they're asking us. Here, number C or letter C, this is the right one. This is the correct one. Why? Because here it says Ria is the suffix, O is the combining vowel, A is the prefix, men is the word root. A means no, without, absence. So there is no, see, without menstrual period or the menstrual flow. So that's basically what it is. So if we kind of learn these word parts, just knowing one of them is going to tell us exactly the entire answer. We don't have to kind of know every single word. No. Remember, process of elimination. If you understand each of the parts of the medical term, or at least one, here we have this, the other one doesn't have anything, the one is A. All of them have meno, so the word root is the same, but one has ria, reja, ria, those are not helpful. But without, that's the key. So when you read these medical terms, start from the suffix yes to interpret it, to give a definition. But when you answer in the test, well, you have to go everywhere and look for a word key that is going to give me the answer without kind of killing myself trying to figure it out what is it. So without, that is A. So that would be a prefix. And the only one that has without is letter C. Okay, moving on. Let's see next. Instrument used for visual examination of the vagina. So instrument should be number one, visual, because this is the instrument, and then vagina. That's it. We have two things right here. Instrument, we know that the instrument is to visualize, but just the instrument is important. A, B, or C. Okay, anyone else? Give it a try, even though if it's not right. So then you will learn. Because when we make mistakes, we learn twice. So we know already, oh yeah, this is the one. No, I thought it wasn't. Now I know that that's not the one. Okay. So because we start by the suffix, we're going to start right here. So mark the suffixes. Those are the ones that you're marking. Scope, scopy, gram. Gram is a recording, an image that we take. It says right here, scopy, this is the actually visual examination without the instrument. Scope is the instrument. So this is what really matters. This is the instrument used to visualize the vagina. Here it says colp. Colp or colpo, that's what it is. Here it says mammon. So it's this one, we definitely eliminate this one. We now fighting between A and B. One is copy, the other one scope. And instruments are scope. Okay. So if you get it right, congratulations. If you weren't sure, now you learn which term was the right one. Moving on, hernia of the bladder. So there are two things right here. Hernia, don't worry about of, the, hernia, and bladder. A, B, or C. So when you start selecting, dividing the parts of the medical term, you can understand that easily. Sometimes there are extra wording there. You don't need to focus much on that. Okay? Anybody else? Gonna give it a try. Well, this is kind of simpler than the first one because actually, well, it has different, well, it's the same suffix, so we don't go for that. So we know already that seal is hernia. Now we have to look for the word root, which is herniated. What structure? So some of the time, once again, just the way that the word is written makes no relation or process or elimination. Scrotal Oh, wait a minute. The scrotum is that pouch where the testicles are. No, that's not what they asking me. And I know that salpingo, oh, wait a minute. That's the uterine tubes. That's the fallopian tubes. So this is not. They're asking about the bladder. Well, cyst, tocil, see, now I have the right one. That's how you have to kind of, go through all these questions and eliminate those who you know they're not part of this. And then try to figure it out from one or from two answers, which one is the most accurate. Next, prolapse of the vagina or vagina prolapse. A, B, or C. Prolapse and vagina. Those are the terms that you have to look for. Anyone? Remember, process of elimination helps a lot. I do that all the time. I use the process of elimination to make sure that I really get this. Okay, so let's solve this. Prolapse of the vagina. So here it says iris. Iris, we know that iris means inflammation. They're not asking about inflammation. Go. Even though if you didn't understand anything, but you know these ones that are very common, iris, or something else. So whatever is left, so Popsis is prolapse or drooping. Colpo, well, we have a note here, combining vowel. This would be the vagina. Just because you see vaginitis has nothing to do because that's inflammation. Colpitis is inflammation. They are not asking me about inflammation, they're asking me about the prolapse. So that is basically how it works. Moving on. Stone in the prostate gland. So we have here stone and the prostate. That's it. A, B, or C. Once again, process of elimination. One more. Okay. So let's solve this one. Let's see. Let's use the suffix IC. Iris. This is pertaining to, this is inflammation. So they're not asking me pertaining to the prostate. No, they're not asking me inflammation of the prostate. So these two options are not correct ones. It says right here, stone. Oh, right here, lift. Prostate. Oh, stone in the prostate. See, once again, learn from me, use the process of elimination, and you're gonna be safe in many things that you're gonna do. Because sometimes we can't know it all. But sometimes you have some reference points that you know that is not the one that they're asking. But you have to be familiar. Because if you're not familiar, it doesn't matter. You're not familiar with these terms, it doesn't matter, well, what is the process of elimination that you're going to follow? You have to know some of the facts, some of the terms, in order for you to determine that this is what you are going to be using. Okay, let's move to the next chapter. Doing very well. This is the senses, eye, ears, nose. Oh, yeah. So we're going to talk about the senses. This is part of the nervous system. So we're going to cover a little bit about this, then we take a break and we'll relax a little bit. Okay. So we're going to talk about the eye and the ear and see what is it in there. What is the function? We know what is the function, but we're going to learn some structures that makes up the eye and the ear. So it's very simple to know that eye, see, it's right here, is a sense of sight, vision. And the eye has a bunch of structures. We might mention some of them. So that's basically what it is. When we talk about the eye, we're referring to sight, vision. That's basically what it is. The ear, hearing. Once again, has a bunch of structures within, but we're going to discuss one of these most important, parts, functions. So we can build medical terms, or we can break down those medical terms, knowing these parts. Some of those names are not written in English. For that reason, are a little difficult to remember. So we have to get familiar with them, practice them, use them continuously so they can stick in our brain. Other than that, it's going to be forgotten. Anatomy and physiology we'll discuss in more detail because this is just medical terms. Yeah, sometimes I have to explain you a little more certain terms, certain conditions, certain procedures, because how you gonna understand the procedure if I don't explain it? That would be, you know, not real. So these are the functions. Function of the eye, we talked already about this, vision, or once again, sight. Function of the ear, hearing, and a sense of balance. So you knew the first one. Probably the second one, you are not that familiar. Do you know that whenever we feel like our ears are clogged or we have this sensation that is kind of full inside or we have an infection of the ear, not only we're not able to hear, but we lost balance. We lost balance. We become dizzy and we can actually fall down. So that's basically what it is. So let's talk about these word roots of each of these organs, because these are organs of our body and very important organs because these are senses. They sense something, sense images, because whatever we see, now we give a meaning to that, a form, a shape. We can describe it, but if you don't see it, and if we cannot hear what the other person is saying, that's going to be hard to communicate effectively with that person. So that's basically what is important, these subjects. The eye, we're going to talk about this term, it's called flepar, blephar, blephar. Remember that the P sounds like an F, blephar. This has to do with eyelids. Can you imagine? The eyelids are called blephar. Here we have irid or irido, irid or irido, blephar or blephar. But these are word roots, not combining forms. For that reason, we don't have the combining vowel. But it can be just for you to understand and remember the vowels. The combining vowels are put in this place to make this pronunciation of these words clear so we can understand it. Because usually the words in between these the words at the end or at the beginning might start with a consonant. So it's going to be very difficult to put together consonants. We have to have vowels in between. So when we read it, it makes sense what we have to say. Irid or irido. This is the iris. The iris of the eye is this dark circle that we have in the center of our eye. That's the one that gives us the color of our eyes. That's called iris. But the word root is irid. Remember, this is a different language. It's not English. Kerat or kerato. This has to do with keratin, right? We heard about keratin, but in this case, we're talking about the cornea. The cornea. The cornea is this little shiny, kind of glassy structure that covers the eye. When you look yourself at the mirror, You see this shiny little stuff that you think that that's your eye, or that's the wall of your eye. No, that shiny little glassy structure that covers the eye in front is called the cornea. We call it kerato or kerat. Why? Because this is a very strong structure that protects the actual lining of the eye on the outside, because the eye is exposed. Environmental situations, something flying into your eye, getting a spill of something, because we are not always protected. We don't carry glasses or goggles every single time. So that's kerato, or kerat is the cornea. Ophthalm, this is eye. Eye. Ophthalm means eye. Opt means eye. But it's used a little different than ophthalm. Opt, remember, ophthalmologist, ophthalmology, the science that studies the eye, or the specialist, the medical specialist of the eye or treats the eye. Optic, remember, you go to the optic to get your lenses, and the person who give you the lenses, the size that you need for your lenses, is called an optometrist. But you go to an optic to get that, or so that's basically what is important about these terms to understand them. But if we see these terms, these parts standing alone, it's going to be difficult to know what it is until you put it together. Because remember, we encountered many words that we knew, that we heard about it. But when we break it down, kind of lost. I have the same feelings as you do. I have to go through this. I have to learn this from scratch, just like you guys doing now. I didn't feel that confident when I was learning this. I was like, oh my God, what did they come out with all these words? What is it that they don't use just my Spanish? And here I said, oh, well, I have to learn it in English. So again, fortunately, we have to learn it. Retin, it comes from retina. That is one of the layers of the eye, the internal layers of the eye, the retina. So that will be discussed in more detail in the upcoming module, which is anatomy and physiology. Sclera or sclera. The sclera is this outer layer of the eye. You see in front of your eye, you see this whitish color of your eye, except for the center, which is the iris, which is the one that it gives you the color of your eye. But everything else is kind of whitish. That is the sclera that surrounds the eye. The cornea is just in the front, covering that part of the sclera. So that's why our eye looks a little shiny. And when we have dry eyes, is because that cornea gets dry, because we don't have all these lubricants that are supposed to be secreted by some little glands. So this is the sclera. Retin, sclera. So the sclera is the outer layer of the eye. So usually with this, we define that the white part of the eye. So that's basically what it is. The irid or the iris, that's the color of your eye. That's how we identify them. That's how the questions for the exam are going to be stated. Which of the following structures is the color of the eye? It's known as the color of the eye. Oh, the iris. Which of the following structure is known as the white part of the eye? Oh, that is the sclera. That's how it is. So we gotta get familiar with those terms, particularly to be prepared, because that's how we call them. Oh, I have problems right here on this part of my eye. People say, talk like that. We talk like that. Because if we don't know the medical terms, you have to explain it somehow. There is something in my eye. I felt it. It bothers me. Let's talk about these word roots and suffixes for the ear. Auri. Now, my mouse is missing. My pointer is most likely missing right here. Auri is audio. It's the sound. This one right here, about this, my ring. Well, this is not your wearing ring or anything alike. This is the tympanic membrane. So the tympanic membrane. So that is the little membrane that separates the external ear canal from the middle ear. So these terms are not, you're not familiar with them. But if somebody says, oh, the tympanic, even better, they say the eardrum. This is the eardrum because it's more commonly used. We don't say tympanic membrane, say the eardrum. That's my ring. Tympanic membrane, my ring, eardrum, same thing. OT. Wait a minute. OT, seriously? What is that? Remember OR? This is not the operating room. No, medical terms. That was mean, oh, oral. Oh, now I understand. That's mouth. Here, it is ear. Remember, we're talking about the ears. That's what we said, otitis. Otitis means somebody has an inflammation of the ear. Otic, pertaining to the ear. Otorhinolaryngology or otorhinolaryngology. Auto. Oh, wait a minute. Ot, ot, combining with the combining vowel o, auto, or auto, whatever you want to pronounce it. So this is ear. Tympan. See, tympan comes from membrane, the tympanic membrane, which is the same as marine, which is the same as eardrum. So depending on the context, or depending on what is it that we want to describe, we will use either or. Remember, some of the medical terms, we cannot use it in combination with certain suffixes or prefixes. They have the unique word root at which they are attached to it. So my rim, tympan, they are the same. Eardrum. OT or ot or auto. Once again, this is E. Suffixes. We have these suffixes. We have discussed one, maybe two of them. Let's see. So here we have meter. We have discussed this. This is the instrument. This is the instrument that we're gonna use to measure sounds, like the sounds, or to visualize the ear. Audiometer. I'm evaluating the decibels, the frequency of the sounds coming through your ears. Well, to determine whether you are a person who is hearing normally or has some problems with hearing loss. So that's basically what it is. So this is the instrument for measuring something. Meter. Remember meter? We know what is a meter. Metri. Now, this is very similar to meter, but this is the actual measurement that we do. Audiometry. Optometry. Not optometrist. Metry. So this is like when we said scopy. Oh, this is the visualization of something. Well, now this is how we are going to measure. This is the actual process of measuring something. Sounds. Because we measure the sounds of our hearing system to see whether you are hearing normally or you're deaf or partial deaf or having problems with hearing. Plegia. This means paralysis. Paralysis, plegia, remember? Paralysis. We're going to talk about hemiplegia, paraplegia, quadriplegia. So when we have paralysis of one of these muscles or membranes, we call it plegia. Because this is, and when part of the nervous system is not functioning or is not reaching these particular muscles, those muscles are going to paralyze. So that would be plegia. Later on, we will discuss the different word parts that we're going to use it as a suffix and make these terms as the one that I mentioned already. Next, ophthalmoscope. Now, if you see right here, the first thing that they show you right here is the instrument, right here. This is the instrument that we use to see, to examine, to visualize, to see through the eye. So we see inside the eye with this instrument. So let's divide it right here, the one on top. Scope, this is the instrument, this is the suffix. O is the combining vowel. Ophthalm is the word root. Remember, word root plus combining vowel equals combining form. So this is the instrument that we use to see inside the eye. This is not a job that you're going to be doing. But yes, you need to be familiar with these instruments because you work with a doctor, and this doctor has this um, ophthalmoscope, and this is not the ophthalmoscope that they have mounted on the wall. So they're gonna ask you, "Oh, can you bring me my ophthalmoscope, or can you bring me your stethoscope?" So you're gonna go say, "Oh, wait a minute, what is ophthalmoscope? I have no idea what this guy is talking about." So they are talking about this particular instrument that we use to um, visually examine inside the eye. So we see it right here. Ophthalm means eye, remember? We use the combining vowel because we have consonant and consonant right here. Scope starts with the consonant. Therefore, we have to put these two vowels. Scope meaning instrument used for visual examination. We are not doing the visual examination. This is just the scope right here. Now, if I said ophthalmoscopy, oh, now I'm doing this. Now I'm actually using that instrument and I'm checking and examining, looking through the eye. So we need to have, this clear so we don't mix up these parts or medical terms. That will be ophthalmoscope. Let's start solving some of these. Um, let's do a couple of them and then we're going to break. We have here blepharitis. Blepharitis. So iris is the suffix. Inflammation. Blepha is the word root, which means eyelids. So this is inflammation of the eyelids. That happens a lot, right? Particularly with these changes in weather, seasons, allergies. Sometimes this give because you use makeup, some chemicals, some irritants. So that is blepharitis. Blepharitis. Next, blepharoplasty. I was like, I just have, I was watching the news and I was watching this actress, Demi Moore, and said, why does she look so younger, so beautiful? Well, she's always been beautiful, right? But they said that she just got this procedure done to her eyelids, blepharoplasty. See, one of the things with age is that the skin kind of zags, droops, because the skin becomes very thin, start lacking. So you have to you can pull up your eyelids. You have to repair them. So plastic is a suffix which means surgical repair, remember? O is a combining vowel. Blephar is the word root. So this is the surgical repair of the eyelids. This is a procedure very commonly used. When we reach certain age, all these tissues start hanging, if you will, or just sagging. Well, there is no creams, there is no other means to keep this tissue from sagging or, drooping or prolapsing. So, surgical procedure, surgical repair. You need plastic surgery. I might need plastic surgery sometime. I don't know. Okay. We need to look good, right? So basically, that's what we do it because we like to look good. Okay. Blepharoptosis. Believe it or not, this is common condition. Osis of this is the suffix. Oh no, but this is the whole thing is topsis. See, I always get messed up myself too with this. It's topsis, not osis. It sounds like. Then don't mix it up. OPT, opt, and osis, because this is the whole thing. So it might be mixed up with opt, vision, condition. So don't get it like that because I already was doing it. So ptosis, that is the suffix. This is ptosis, the suffix. O is the combining vowel, and blephar is the word root, which means eyelids. So this is the drooping of the eyelids. When you see someone like there is a term that I forget already, that feels like the eye droops, the
Lazy
eyelid.
eye.
That's the word, yeah. So it droops and it feels like that eye is like, yeah, the lazy eye. I was thinking I have it in my mind, but I was like, somebody's stealing it. Somebody's getting into my brain, stealing my words. Well, I didn't know that was possible, but now I prove it that it's possible. Yes, that is the one. Blepharoptosis. Really bad. But that is because these nerves, that has nothing to do with age. It can be someone very young. This has to do with these little ligaments that holds the eyelids, upright. Then it becomes very weak. So they kind of becomes very dilated, they stretch. So then the lids falls down, they prolapse, they droop. That's basically what it is. It's nothing else. It's just that. That can be because medical conditions, medications. It happens also for the patients that have a medical condition like stroke, uh, Bell's palsy, or this facial problem that sometimes happens in people. Then one side of the face kind of droops, kind of twisted because these muscles loses their support from those ligaments. Then not good because the nervous system is not working. Okay, so let's move to iridectomy. Oh, be careful with this word. You don't say something like it's an iridectomy. 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 So ectomy is the suffix, means surgical removal. Irid is the iris. This is the word. Seriously, removing the iris? Okay. Surgical removal of the iris. Never seen such a thing, but remember, we just forming medical terms. Whether it exists or it doesn't, but some of these medical terms, some of these medical procedures actually don't exist. So you might try to color your iris, you might use contact lenses or just color it, put some medications there to maybe shrink it or dilate it for ophthalmic tests, but removing it, well. So this is according to the medical term. Remember, not every single medical term is applicable. It doesn't mean that this procedure actually exists. We just put in words together to give them a meaning and form medical terms. That's basically what it is. Here, iridoplasia. Now, plagia, remember, is paralysis. So this is the suffix is paralysis. O is the combining vowel. Iri is the word root. So this is paralysis of the iris. Well, this is the iris inside the eye. This is the eye. This is the iris right here in the middle. There is a little hole. That's called the pupil. Now, all this color of the eye, just let's use blue, just like my color of my eyes. Do you know that my color of my eyes are blue? For those who knew me, those have the chance to meet with me, my eyes are blue. So if you think that it's not, or you say otherwise, that's not nice. Okay, so this is the color of the eye, right? So right in the center, we have the pupil, which is a dark spot right here. Oops. Well, this pupil is a little window where light goes through inside the eye. That's the eye goes all the way inside the eye. That's the window. So if this iris becomes paralyzed, this becomes paralyzed, meaning that doesn't open when there is no light. Remember, or when you get scared, that your eyes kind of pop up, then the little window that is right there called the pupil, they kind of stretch. It's like for people who use certain drugs. That's how I know, because I always check in on my son. I said, okay, let me check your eyes. If I see that his eyes are dilated, I know what he smokes. If they are constricted, too narrow, I know what he smokes. Certain medications cause this, certain conditions. So if the iris paralyzes, doesn't open, doesn't constrict, stays fixed. That is what idioplegia means. See? Right? So you shouldn't be forgetting this. Not that you're going to have it in a test, but that's what actually this is. That's idioplegia. Because you might say, okay, how is the iris paralyzed? Well, I haven't seen anybody removing the iris, but I don't know how's that. But idioplegia does exist. So this is a real deal. Keratoplasty. Now, keratoplasty, before we go on break, plasty is the suffix surgical repair. O is the combining vowel. Kerat is the cornea. So this is fixing, repairing surgically the cornea. You have a damage to the cornea, something flew into your eye, damaged, scratch it, or you just start rubbing your eye and something was there, you can damage your cornea. So that can cause problems. So for that reason, it can be fixed. It can be fixed. That's why we have to wear goggles, glasses, personal protective equipment when we are handling things that might have splashes, like the welders, all with these machines and little pieces of metal flying everywhere, or cutting something or painting something. Anytime that we are exposed, construction, anything that you're doing, protect your eyes because this can damage your eye. Okay, last but not least, ophthalmologists. So this is the eye doctor. That's it. But people don't say, I'm going to the ophthalmologist. That is a very long word to pronounce, right? So we have here logist, the suffix o is a combining vowel. Ophthalm is the word root, which means eye. Can you imagine ophthalm, eye? We use I in English, 3 letters. Here it has like 100. So this is the specialist of the eye. Remember, this is the specialist of the eye. Specialist of the eye. That's it. This is the medical doctor that treats the eye. It's not the same as an optometrist. An optometrist is a doctor that treats your eye, but not the structures of your eye. This is the one that gives you the glasses. This is the one that the doctor prescribed the glasses. You go to the optometrist, they measure the level of vision that you have to lay the glasses to the side. That is different. So optometrist, ophthalmologist, there are two medical specialists. One focus on the actual structures of the anatomy and treatment of the eye. The other one on the treatment of what you're going to be using to kind of fix some problems of your eye. You're not going to be able to see close, to see far. So you have blurred vision. Oh, well, something like that. You cannot see small letters. You cannot see something far away. You cannot see something close by. Then that's the optometrist. Good. Okay, so we're gonna take a break because it's already past. So it's 7:10. So we come back at 7. Oh, almost that. 10, 24, 30, 35. 7:35. Okay. All right. See you at 7:35. Okay. Enjoy your break. Okay, so we are back. Let's see, one more minute.
I'm here.
Okay, good. I hope you guys enjoy your break
Here,
as
teacher.
much as I did. Okay, let's continue with this chapter. We're almost done. Remember, tomorrow there is no class. We're gonna meet on Monday, and that will be the last day of this class. And Tuesday, we're gonna start with anatomy and physiology. Okay. So let's continue with these terms. So we have here ophthalmoscope. Scope, the suffix o is a combining vowel. Ophthalm is the word root. Scope, remember, this is the instrument. And what is this instrument gonna be used for? To visualize, to see inside the eye. This is an instrument used to see, to visualize inside the eye. Here we have another term, optic. IC is the suffix. Opt is the eye, it's the word root, pertaining to the eye. We can also say pertaining to the glasses. So all depends on the context. Remember, all depends on what is it that we are talking about. So we can say once again, pertaining to the eye, to the glasses, because optic, um, or optometrist, optometry. Remember, optometry is actually the the science. Oh no, that was the science. Well, I'm gonna see it later on. Here it is. Optometer. Meter is the suffix which means measure. This is something that we use like an instrument that used to measure. O is a combining vowel. Opt is the eye or the glasses. We can use this to measure the pressure of the eye or an optometer. Optometer. Or we can measure the sides or the right side of the glasses that you guys gonna use if glasses are prescribed. So that is basically what it is. You can use that. This is optometry. Optometry is actually doing the test. Remember, I use this optometer and I'm using it to whether measure the sounds of the hearing, the decibels, or measuring the actually level of the glasses. So you can use it either or. So for this case, we're not talking about the sounds because this is not the ears, but we're talking about the eyes. So we are checking the size of the glasses that we're going to use that are being prescribed. Remember, we have different levels of glasses. Not every single glass is made or customized for everybody. All depends on the level of vision that you have lost. That's what we measure there. So we measure the pressure of the eye or the size of your glasses. That's optometry. Here we have another term, very easy, retinal. Retinal. AL is the suffix pertaining to, and retina is the inner layer of the eye, which is the word root. The inner layer of the eye, or that's basically what it is, pertaining to the retina, which is the inner layer of the eye. When we get to anatomy and physiology, we're going to talk about all the layers of the eye. Remember, we have the sclera, which is the outer layer, the retina, which is the inner layer. Later on, within anatomy and physiology, we're going to talk about the choroid, which is the middle layer. So for now, we're just going to leave it here because these are the structures, the inner and the outer layer of the eye are the structures that are the most common for the eye. So for that reason, we do not mention the middle layer. Retinitis. Be careful, you have to say retinitis or retinitis because otherwise it's going to sound like rhinitis, which is inflammation of the nose. So we need to kind of pronounce this T that is in between right here. We need because we are talking about the retina. So iris, as we know, is the suffix, which means inflammation. Retina or retin is the word root for the retina. Inflammation of the retina or the inner layer of the eye. Scleral, AL is the suffix. Scler is the word root. AL pertaining to scler is the sclera, the outer layer of the eye, the white part of the eye. That is the sclera. So this is pertaining to the sclera, something that belongs to the sclera. We're talking about the sclera, a part of it, a condition of, a procedure to, whatever the case may be. But we're talking about the sclera here.
Professor, Danielle asked you a question in the comments.
Oh, let me see. Sometimes I have a little bit that goes, but I have a different windows right here. So the window with the last question, yeah, no problem. Thank you. It says right here that quick question, Dr. Hoyer, with this. Okay, let me put my glasses because that's very small. That's what I don't like the chat. I know when you said something, quick question, Professor Hoyer, will there be tests for this term? Well, yes. Remember yesterday I mentioned probably today I'm gonna send you a test, which is take-home test, and you're gonna have until Tuesday to answer that test. It is 70 questions. You don't have to kind of break down terms or anything like that and name them. No, everything is done for you. The only thing that you have to do is give me definitions. What is this? What is, let's say here, what is retinitis? What is gastritis? What is the suffix for gastritis? What is the suffix? How you know this is a suffix? What is the word root? How you know it is a word root? What is the prefix? How do you know that is the prefix? So things like that. There's definitions mostly that we're gonna go over, okay? So you're gonna have until Tuesday to answer this test. I'm gonna email it to you in a PDF format. You're gonna highlight it because this PDF format, you have to download it. You cannot work directly within the email. You download it into your system in a folder that you know what is going to be saved, and then you answer the questions little by little because you have all these days to work on it. You highlight the right answer, then you save it, do little portions today, tomorrow, a day after, and save it. And then continue with the rest. You don't have to answer the test at once. So you read it, you review your notes. If you are sure, if you want to prove yourself that you understood all these and you know some of them, and you feel confident, answer the ones that you feel confident. The one that you don't, look for the answers. Once again, for those who weren't in my practice classes, um, or you will join the class, after that, the reason that I'm giving you this test like this is because I want you to learn it. I want you to review it. I want you to make sure that you get the right answer because this is difficult. Most of the things are difficult, and we almost not even 3 weeks are covering a bunch of chapters. How can I expect that you're gonna learn all this? Even though if you have all the time of your life, meaning you don't have anything else, you don't do anything, everybody do everything for you, still you're not gonna be able to answer all these questions. So I want you to learn it. I want you to go over there, try, read the notes, make sure that you review these so you should okay? So later on, the latest I'm gonna be sending this, it will be tomorrow morning, but I'm pretty sure that after the class, I'm gonna send it to you. I just wanna make sure that all of you that are in my class receive all these materials because to that same email, I'm gonna email you the test. So I don't want you to tell me later on, wow, I never received any of these lectures on the email. And then at the last minute, you say, oh, I never received the test. Remember, if you are missing some materials, if you, for any reason, didn't get my materials, let me know because I will try to send it again, or I will explain you how to get these materials because sometimes you receive it in your email, but my email is new to you. So sometimes the system send it to the scam folder. So look at the scam folder. Sometimes they are there. So before you do anything else, you do all this and you don't find it, put my email right there on the little search window on your email. Put my email. As soon as you put it, if I send you any emails, they're gonna show up right there. If after that you didn't get it, contact me. But contact me, right away so you have plenty of time to complete your assignments. Because I don't want you, you know, to get a bad grade because you didn't communicate with me or you didn't inform me what's going on. All right. So yes, it will be a test, and I will be sending it to you after the class, and I will be expecting you to send me the test back by Tuesday. I will write it down in the email, so not a problem. Okay. Any other questions? Sometimes if you put in the chat, remember, I don't see it. Because I have two different windows, because I have full window for the presentation, so I can go over and write and work. Other than that, it presents a very small window. I'm not gonna be able to do all this on the window that I have all of you. So yeah, thank you for letting me know, Mercedes. I believe that was you, right?
Yes, no problem.
Okay, yeah, let me know, and ask me, or if you read it, ask on behalf of them and said, so professor, I have a question for you. Don't worry, it's not because you are the one who asking, but you said, hey, I'm asking you on behalf of such and such, not a problem. I have no problem with that. All right. So it was clear that there is going to be a test, and it's take my email, you're gonna answer it, and you're gonna save it, and you're gonna return it back to me, to my email, and then I will give you the grade after I receive it. Okay. Once again, you have until Tuesday, so don't rush. Don't start like, oh no, I just received it, I have to do it now. No, sometimes we don't have time. Sometimes I want you to do it slowly. That's what I give you plenty of time so you can work on it. Okay? If anything else, just let me know. Once again, if you, for any reason, you hear that your classmate received the test, but you did not, make sure that you contact me, or make sure that you ask them to forward it to you. That's how we do it, because it's not that the test is already answered. No, it's a blank test. So you don't have to type things. You have only to check because it's a multiple choice. All right. And send me back the same text with the highlight answer, or just circle it, whatever you want to do. Don't send me separate answers in a separate sheet, because I don't know these. I have to see the question and compare it with the answers. So that's basically what I want, okay? All right. So if you have any other questions, please feel free. Remember, email me. I always check in my emails. And if something, I give you more instructions on how these, how I'm going to conduct these exams. All right. So moving on, Autoscope. So auto, don't mix it up with auto. See, auto. See, because sometimes we use the T, we pronounce it as an R. So autoscope and autoscope, that's sometimes we have to scope, has to pronounce it a little different because it can make mixed up. See, this is autoscope with R-O-R, this is O-T. So autoscope with R, it will be mouth. So it will be the scope to check inside the mouth. We don't have a scope to check inside the mouth, but let's assume that that exists. Otoscope, on the other hand, with T, then will be the instrument that we are going to view or to visualize, or it is a visual exam of the ears. So that's basically what it is. So we're going to have a scope right here, which is the combining vowel, and ot is the word root. Instrument used to visualize the ears. That's exactly what's going on right here. Now, once again, you are not the one that is going to be using this instrument to visualize your patient's ears. No, that's the job of the doctor. But we need to know, sometimes they have these mobile stethoscope, otoscopes, of ophthalmoscope. I have this and I use this, and it has just changed the head. See, this is the head of the otoscope, and I just remove it and place the ophthalmoscope right there. So this is something that we use this handle for both the ophthalmoscope and the otoscope. That is if you have one that is mobile. So you have it on, the doctor have it under, on one of the drawers of his or her desk. Some of the times they have it mounted on the wall. So if they have it mounted on the wall, we just make sure that it has all the supplies that are needed. So that's basically what it is. So later on, when we get to that part in anatomy and physiology and some medical procedures, you need to know what is needed so the doctor can use all, the parts of the supplies that are needed for you to do this. This is not just putting the scope right there. It needs some little devices to protect and the otoscope. And those are disposable, some covers. Then you have to have them. That's called specula, but we will discuss that later. Right now, we're talking about just these medical terms. Remember, OT means ear, This is the combining vowel O, and scope is the instrument. So this is an instrument used to see, to visualize inside the ear. That's basically what it is. So you're gonna get very familiar with all these instruments just in case, once again, the doctor says, oh, have you seen my otoscope? Can you please bring me the otoscope? I have it right there on my office. Then you know what you're looking for, at least for that. So very important that we know sometimes little details here and there. Okay, let's continue with these terms now related to the ear. Audiologist. Logist means the specialist, the medical doctor, the professional. O is the combining vowel. Ori is the word root for sounds. So this is the specialist of the sounds of the ear, of the hearing. This is the doctor who examines your hearing levels. That's basically what it is. So an audiologist. So be careful with all these terms because some of them are very similar and we might mix them up. We don't say otologist. We don't say that. Ears and logist. No, it's related to hearing or sounds, which is audio. Audiology, remember this is the specialist. This is the department of audiology. Logi is the suffix. O is the combining vowel. And ori is the word root for hearing or hearing the sounds, of course. Since the science that studies hearing or the hearing sounds. Now, if you work with a audiologist, you might have to learn how you do this. So you have to do the test sometimes. They train you to do this. Otherwise, you just do other things because most of the time, you might not end up working on one of these specialties, but if you decide to do so, it's better to work for a general doctor, family practice, internal medicine, because it's a little bit of everything. So usually if you go to the audiologist, you're not gonna draw blood, you're not gonna do EKGs. Everything is related to, the ears. It's like if you work with a dentist, you're not gonna do blood either. You're not gonna do EKGs. You're just gonna focus on assisting. That's what these have a different assistants. They have a dental assistant instead of having a medical assistant. Some of the specialties kind of goes a little, off certain duties that you learn here. You're not gonna work for the radiology department either because you were trained as a radiologist assistant. Audiometer. So meter, remember, is the suffix, which means the instrument that measures the hearing of the sounds that we are hearing, and that's the test. That's an instrument that checks what is, the level of your hearing. So that's basically what it is. Next, this is laryngitis. Remember, marine means the eardrum or the tympanic membrane, and itis is inflammation. So this is the suffix. Marine is the word root because it's a structure of the body. So this is inflammation of the eardrum. Yes, this happens. An infection to the inner canal or the external canal can inflame the tympanic membrane. That is a very small membrane that allows the sounds to pass through this membrane, and it got swollen. Therefore, you're not going to be able to hear, and that causes a little pain as well. So this comes with external otitis or otitis media, which is an inflammation of the internal ear, the middle ear, I'm sorry. So that's basically how it works. That would be laryngitis. Laryngoplasty. Laryngoplasty. So plasty is the suffix. We know this means surgical repair. We are using most of the same suffixes, and the prefixes depend on, I'm sorry, and the word roots depending of the subject or that we're discussing. Try to repeat most of them so you can get familiar. See, aureologist, aureology, aureometer, my laryngitis, laryngoplasty, laryngotomy. See, so you can get familiar, because if we start changing and using once in a while a different one, so then it's gonna be tough to kind to memorize these names, these terms, these word root, these suffixes or prefixes. The word root, we're not worried about that, but the terms, the parts are very important. So what's going on here? So O is the word root, so plastic, this is a surgical repair of the eardrum. Well, if you have perforation of your eardrum, we have to repair it. Remember that little membrane right there that forms like a curtain that doesn't allow anything from the external area to go through the middle canal, the inner canal. That is a little curtain that prevents things from going inside. So that's little bugs or whatever else, it doesn't go, water doesn't go inside the canal, but doesn't go inside the middle ear. Let me show you the ear right here so we can have an understanding right here. So if we see here, this is the middle ear. This is the inner ear. This is the external ear. This part is when you put the Q-tips. See, you put the Q-tips. Here is the membrane. Right here, you see it. That's the membrane. That's my ring. And when you use Q-tips and you don't know how to use it and you push too hard against this eardrum, you can actually break that. That's not supposed to be broken. So laryngoplastic fixes that. If you have an infection to the middle ear, that can swell this, that can inflame this membrane. So if this membrane is too thick, when the air goes through here with the sounds, it doesn't pass through. So you cannot hear anything. If you have wax here in this canal, the sounds are not gonna pass through. So you're not gonna hear anything, or you're gonna hear it very muffled. That is how it works. So that is the membrane, because the ear canal has three parts. See, the external, the outer ear, the middle ear, and the inner ear, just the way that I explained it here. And each part has its own functions. Okay. Let's go back again to this part. So that would be laryngoplasty. Remember, we do a surgical repair of the ear, but this is the eardrum. Now, maringotomy, see right here. So we need to know a stomy. This is the suffix, which means incision, cutting into. Here we have the combining vowel and the word root, which is the eardrum. So this is doing an incision in the eardrum. Oh, wait a minute. Do we do incisions in the eardrum? Yes. When the middle ear, this is the middle ear, this is the other ear, this is the three channels. The external part